Phacoblues are tough complication.
Good morning all. I am going to present Phacoblues, a tough complication. There is no financial disclosure. As we all know, trypan blues is used for staining anterior capsule during cataract surgery, but it can lead to staining of posterior capsule or vitreous in many cases of zonular compromise. So we are going to report few cases with similar staining in absence of zonular compromise. First of all, this is a case 1 where 45-year-old female come to our OPD with diminution of vision in right eye. There was history of trauma to right eye with wooden stick. So anterior segment examination, as we can see in this image, it reveals iridodialysis and there was subluxation of lens. So while staining the anterior capsule, we saw that there was posterior spilling of dye in the vitreous, anterior vitreous from the area of subluxation. Our case 2 is 20-year-old male complaints of diminution of vision. There was no any history of ocular trauma, redness, pain or previous ocular surgery. There was no any sign of zonular compromise or pseudoexfoliation or uveitis. So as we can see, there was inadequate pupillary dilation. So we use excessive amount of OVD to achieve adequate pupillary dilation, and after staining of anterior capsule was done. So after rhexis after starting the phacoemulsification, we noted that there was a bluish fundal glow and we saw that there was posterior spilling of dye in anterior vitreous face. Our third case was a 45-year-old male who came to our OPD with a complaints of diminution of vision. There was a history of intravitreal injection in right eye due to severe NPDR, and there was no any sign of zonular compromise which was noted preoperatively. As we can see, there was a small cataractous changes in the quadrant of intravitreal injection was given, and after staining the anterior capsule and AC wash was done, and we noted that there was posterior spilling of dye from the quadrant where intravitreal injection was given. After doing phacoemulsification, we noted that bluish fundal glow was seen in that quadrant only. And in post-op period, there was a bluish tint visible in the fundus examination, which was disappeared up to first week post-op in all the cases, and there was no any sign of retinal toxicity or decrease in vision in all the cases. So as we all know, staining of posterior capsule is very common in zonular compromised cases, that is in trauma or subluxation of lenses, which was seen in our first case. In our second case, there was inadequate pupillary dilation, so we hypothesized that we use excessive amount of OVD to achieve adequate pupillary dilation, which can lead to raise in IOP and which force the dye to push more posteriorly through normal zonules. And this was supported by a few case reports, that is Marquez et al. And Pellet et al., which used iris retractors to achieve adequate pupillary dilation. In our third case, there was history of intravitreal injection, so according to Welles et al., which hypothesized that intravitreal injection caused inadvertent posterior microtrauma and biochemical damage to zonules. So I will like to tell few steps that by creating viscoelastic barrier we can prevent it. As we can see, there is large subluxation, so we inject dispersive OVD in the area of subluxation to create a barrier, and after that anterior capsular staining was done, and after staining with the help of CTR or CTS, we proceed for the further phacoemulsification, and we saw that there was no any posterior spilling of dye during the surgery, as we can see here, and after phacoemulsification there was no any posterior spilling of dye. So my take home message from all the three cases is that there is possibility of posterior vitreous staining which can be seen in patients with no clinical signs of zonular dehiscence, as we seen in our second and third case. It can lead to unusual complication by poor visualization during surgeries. So we should take pre-op measures and preventive strategies if we can do any. Thank you.